Hello everyone, now let us discuss about modifiers 58 and 59 with examples. First coming to modifier 58, which is nothing but staged or related procedure or service by same physician or other qualified healthcare professional during the post-operative period. So whenever a related or planned procedure is performed during the post-operative period, that is first one procedure is performed and during the post-operative period, if a planned or related procedure is performed, then you need to append 58 modifier to that related procedure. And it may be necessary to indicate that performance of the procedure or service during the post-operative period was, it must be planned or anticipated, so as the name staged, or it can be more extensive than the original procedure. Even that case you can append 58 modifier, or that procedure, planned or anticipated procedure, is for therapy following a surgical procedure. Under these circumstances, you need to append modifier 58 to the staged or related procedure. One important note is, for the treatment of a problem that requires a return to the operating room or procedure room. For example, unanticipated, it was not planned. Unanticipated clinical condition. For such cases, you need to see 78 modifier. We will discuss when we talk about 78 modifier. As of now, for unanticipated clinical condition, if a person need to return to operating room or procedure room, then you must refer 78 modifier. But if the procedure is related and planned, then you need to append 58 modifier. Let us see an example. On February 1st, the patient undergoes a iridectomy. The CPT is 66761 on his left eye. In the medical record, surgeon states that patient may need a laser trabeculoplasty on the same eye. This is a planned procedure. On April 10th, the patient sees the doctor for the follow-up visit and the surgeon decides to perform the second surgery the next day. So here, the trabeculoplasty should be billed with 58 modifier and LT modifier to indicate the left side laterality. So CPT 65855 should be appended with 58 modifier to indicate anticipated or planned procedure during the post-operative period. First iridectomy was performed and for the same eye, trabeculoplasty is performed after some days during the post-operative period. To indicate that 58 modifier is appended. Now coming to modifier 59, which is nothing but distinct procedural services. Under certain circumstances, it may be necessary to indicate that a procedure or service was distinct or independent from the non-E&M service performed on the same day. In such cases, modifier 59 is used to identify procedures or services other than E&M services that are not normally reported together but are appropriate under circumstances. And documentation must support a different session, different procedure or surgery, different site or organ system, separate incision or excision, separate lesion or separate injury. These are some of the specification. It must be either a different session, different procedure or surgery, different site or organ system, separate incision or excision, separate lesion or separate injury, or area of injury in extensive injuries are not ordinarily encountered or performed on the same day by the same individual. However, when another already established modifier is appropriate, it should be used rather than 59 modifier. And only if no more descriptive modifier is available and the use of 59 modifier best explains the circumstances, then modifier 59 should be used. One important note is modifier 59 should not be appended to E&M service. modifier 59 should not be appended to E&M service, and to report a separate distinct E&M service with a non-E&M service performed on the same day, you need to append 25 modifier to the E&M service. You can check the 25 modifier for further reference. One more important note is 59 modifier should not be appended for add-on codes. Let us see an example. Here, patient presents with lesion of lung and arm. Here, lesion is on two sides. FNA was performed. Fine needle biopsy. Fine needle aspiration was performed for lesion of lung with ultrasound guidance. Whereas one more FNA of lesion of arm was performed with magnetic resonance guidance in the same session, same day. But the lesions and site are different, and also guidance. One FNA is performed using ultrasound guidance, then the other FNA is performed using magnetic resonance guidance. So for this scenario, the appropriate CPTs would be first 10005, which is nothing but fine needle aspiration biopsy, including ultrasound guidance, first lesion. This is for lesion of lung, followed by 10011, along with 59 modifier to indicate a distinct procedural service. Fine needle aspiration biopsy, including MR guidance, first lesion. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.